History, the history of chickenpox. Causes, what causes chickenpox. Symptoms, the symptoms of chickenpox. Demographics, where chickenpox is most prevalent, and the major outbreaks of chickenpox. Treatments, the treatments of chickenpox. Different strains and types of chickenpox. Prevention of chickenpox, and then finally my experiment, and then my conclusion. History. My disease was first found by Giovanni Filippino in Italy in 1500. In the 1500s. Then in 1875, a man named Richard Steiner found that the demonstrated that chickenpox was caused by an infectious agent by inoculating volunteers with the vascular fluid by patients that have chickenpox. Then in 1888, von Backe found that children with chickenpox were not immune to herpes zoster, even if they were immune to chickenpox, because herpes zoster was not the same as chickenpox. Causes. Chickenpox causes blisters, rash. Chickenpox is caused by an infected person by saliva, blisters, rash, or then even touching you. If you touch or breathe in virus particles with a blister, you will get chickenpox. You can give chickenpox to somebody else 1 to 2 days after you catch chickenpox. The usual person has 10 to 21 days before they can notice symptoms. The disease remains contagious until all blisters are crusted over. After you get chickenpox, you're usually immune to it because your body gets used to the disease and you can fight it off. Symptoms. Symptoms include sore throat, fever, rash, blisters, runny nose, nausea, stomachache, cough, fatigue, and etc. Serious symptoms include dehydration, brain infections, bloodstream infections, toxic shock syndrome, bone and joint infections, pneumonia, dehydration, and death. Demographics and outbreaks. My disease really hits the young age range really hard because it's the young. You can get it really early as a baby because you really don't have the vaccine yet. 39% of all cases happen in the age range 1 to 4 in UK, US, and Japan. This disease is also very prominent in places that have very populated areas, like every area that has over 3 million people. On the other hand, places like the West Indies, India, and South Asia don't get the chickenpox later on in life, like at 20 or 30. Treatments and cures. If your child falls into a high-risk group for chickenpox, he or she will get prescribed valsiclovir or Zovirax, or another drug like immune globulin intravenous, IgIV. Or the other antiviral drugs like valsiclovir or famiclovir have been prescribed, but they only work in adults. You can also take the vaccine Vivarax, which is 0.5 milliliters. But you will get 2 of those between the ages of 2 months and 12 years. Some homemade remedies include cold bath with added oatmeal, calamine lotion, ointment, and keeping your fingernails trimmed short to keep away blisters. Don't give somebody, please do not give somebody aspirin if they have chickenpox, because that will cause Raynaud's syndrome. Raynaud's syndrome causes swelling of the liver, permanent brain loss, and death. This disease does not actually mean, it doesn't really kill that many, so just don't take aspirin if you have chickenpox. Different strands and types of chickenpox. Chickenpox has two different types of strands. It's shingles and chickenpox, varicella pneumonia. Shingles is a viral infection that causes a painful rash. Although shingles can occur anywhere on your body, it mostly occurs either on the right or left side of your torso. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. After you get chickenpox, the virus hides inside, under your brain and spinal cord until boom, shingles. Varicella pneumonia. Varicella pneumonia is a type of viral pneumonia or lung infection that is an uncommon complication with chickenpox. By traveling to the lungs, it causes lesions on your lungs, and it causes you to not be able to breathe. It is a common cause of multiple small. Varicella zoster virus, mostly commonly called self-limited benign disease in children. However, it tends to cause significant problems in adults. Prevention. The best way to prevent chickenpox is to not go around anybody that has chickenpox. Do not breathe their air or touch them at all. If you do touch them, you will catch chickenpox no matter what. Parents typically wonder whether the vaccines are safe. Well, I think the vaccine is safe. My experiment was based off whether you could give the measles vaccine to a patient with chickenpox or a patient with herpes zoster, and whether it'd be successful or not. The 151 patients with chickenpox that took the measles vaccine, all 151 patients were cured successfully. But the results were different for the 145 patients that took the herpes zoster. Only 91.7 were cured successfully. 8.3 were only effectively treated. In conclusion, chickenpox is easily transmitted through contact, any type of contact, breathing, touching, blisters. Shingles and varicella pneumonia are both very bad diseases, and they're both worse than chickenpox. And they're both different strands. And chickenpox is looked upon as a non-harmful disease, but it can be a very harmful disease. It can hurt you in a lot of ways. Thank you. This concludes our presentation. No, you have 1-3 chance. Math.
You know why they named it chickenpox?
First they named it. First they thought it was named smallpox, but they named it chickenpox because they really didn't specify that. Isaac. Well, over 11,000 go to the hospital every year, and 100 to 150 die.
You said that in the West Indies, Japan, and India, I believe, that when they were older, they got the 20 to 30 range. Do you know why that is?
I think it's because they really, I looked it up, but they really didn't specify. I mean, I think it's because of less, maybe, because here in the U.S. I think we have more cases of chickenpox here, so maybe it's because, and we have